Now today, at long last, we enter a discussion on cures. Before, in our previous discussions, we covered the consequences of having a severely mentally impaired person in the power of the presidency that was beyond his capacity to handle. Through influence and exposure, symptoms can spread into becoming a shared psychosis in the end, or group-level loss of contact with reality. Simultaneously, sociopathic tendencies represent both predatory exploitation of these vulnerabilities as well as symptoms that are the most contagious. Like any epidemic, Trump contagion is best approached as a public health problem that we can intervene with at multiple levels. The first proposed intervention that's necessary in the immediate term is the most dramatic and costly, but least effective. Yet, an advanced stage of disease, this stage cannot be skipped. It's the approach that the public will find most understandable and impressive, but is actually the least effective. Examples of this include surgery or medication. It's also called tertiary prevention, which in public health indicates intervention with those who have already fallen ill, so that the focus is on treatment of symptoms and on alleviating the progression of disease. The next level intervention is intermediary, less dramatic and less costly, but more efficient through the use of a targeted approach. It's called secondary prevention, or interventions with groups that are at risk of getting ill. Examples might include the prevention of cancer by convincing a smoker to give up the habit, or encouraging mammograms and colonoscopies to patients of a certain age. Finally, the least costly and the most effective of all is primary prevention, or interventions at the level of the population that aim to improve health and to prevent disease before it occurs. This may include nationwide vaccination campaigns, seatbelt laws, sanitation of the water supply, or public health education campaigns. Now, this is why, as mental health experts, we approach Trump contagion in the same way, as a public health threat that would bring down our collective state of health and our ability to achieve higher goals if it were allowed to progress to what eventually would become a shared psychosis. This is why I made clear in the introduction of The Dangerous Case of Donald Trump that this was a public health issue, not a matter of an individual's private mental health. There were mental symptoms in a prominent public figure that would loom large and come to affect the public's mental health as well as health, physical health and survival ultimately. So we warned since the beginning that the concerns we raised on Donald Trump's mental impairments were a matter of public interest, not a personal or even an ad hominem attack. His occupation of the US presidency had consequences for the level of our public mental health and the caliber of our politics, the survival of our democracy, public safety, and eventually geopolitical stability because of the nature of the pathology. And the nature of pathology is that it would bring down our level of function, ultimately to cause our own destruction and demise. During the COVID-19 pandemic, and more strongly after the January 6th violent insurrection against the government, my colleagues and I called for criminal arrest of the then president as a form of public health intervention, that is tertiary prevention. The reason for our doing so was not partisan or political or even legal, but medical, as a potentially effective method for curtailing Donald Trump's shared psychosis and reining in behavior that could infectiously sweep through the country. Whereas a swift arrest and consequences would have been most effective for psychological deterrence, even the usual prosecution time is too long for the short attention spans of the most dangerous personalities. And these are some of the reasons why mental health experts, especially forensic psychiatrists such as myself, routinely consult with the courts on appropriate sentencing. Now, more than 3 years since our last public recommendations regarding Donald Trump, on May 30th, 2024, a criminal justice intervention finally happened when Justice Juan Merchan of the Manhattan District Court convicted Donald Trump of being guilty of felony crimes. So it was, in the end, not the Department of Justice, the US Supreme Court, or even a federal court, but a New York State trial court that conferred on Donald Trump a felony conviction on 34 counts for falsifying records to cover up a sex scandal that would deceive the public and interfere with the 2016 US presidential election. I've worked in criminal courts for over 25 years, and they are the most rigorous in procedure. A jury delivered a guilty verdict at the highest standard of beyond a reasonable doubt, which is the required standard for criminal convictions. So it's an extraordinary accomplishment that provided Americans with vital information about a presidential candidate before they would go to vote. But of course, we know what has happened with all his other criminal trials in terms of the unprecedented delays that are so outside of ordinary procedure, as well as the US Supreme Court's ruling of absolute immunity for official acts. And therefore, all these cases had to go under reconsideration, including Justice Merchan's case in Manhattan District Court. But nevertheless, this was an important milestone in holding Donald Trump accountable after more than 3.5 years of lack of accountability, impunity, and the exact opposite of what we need to do to contain dangerous personalities. So it was 12 ordinary citizens holding an ex-president accountable upon hearing the evidence and applying the law, and that's a powerful counterbalance to authoritarianism and a reestablishment of norms and standards. I have to repent here that all the times that I've lamented having to explain the fine details of expert opinion to laypersons in the jury, which I didn't quite see the full benefits of. And now I do see just how important a role a jury can take and how a jury's function can empower the public. And what is little known about dangerous personalities is that external imposition of the law, structure, and containment is not only what is necessary to reduce their excesses, but it's actually comforting for them, since for those who have few internal limits, external ones give contour to the world. We see how Donald Trump's immunity has ballooned into impunity. He has already praised Hannibal Lecter as a wonderful man and Al Capone as seriously tough, describing the kinds of personalities he admires. Gang leaders make extreme demands, such as for a new member to go through the rite of passage, sometimes of killing a police officer or random homeless person, much like the recruitment of child soldiers who may be commanded to kill members of their own family even. Compelling such extreme sacrifices ensures that followers will not be capable of turning back, as well as entrenches unlimited power over them. Trump devotees have now had to endure defending him through a Foreign Enemy Medal 2016 election, a pandemic that took more American lives than all the wars since the Civil War combined, a lost 2020 election that he claimed he won, and now a verdict that he claims was rigged, but is a felony conviction nonetheless. So these are similar sacrifices that Donald Trump is forcing his followers to make, and actually give them no other option by instilling fear in them that if they were to abandon him, then they would either not have a country anymore, or the so-called fascists and Marxists will take over this country. Well, we know exactly what he is projecting onto others. Now, his campaign immediately started fundraising and raking in millions in the first few days of his verdict. And he called himself a political prisoner, and it demonstrates the panic and the exploitation of his followers' desire to deny, since they've invested too much in his presidency and candidacy. And there have been billionaires' capitalization of this compulsion. So he's had a great deal of the support of those who are wealthy and powerful. But contrary to our ordinary notions, this is actually an opportune moment to continue relentlessly and not to stop. So it is, of course, very disappointing that the sentencing will not happen any longer until after the election. But we can continue to point out the narrative of his, or establish the narrative of just how criminal and felonious this presidential candidate is, as proven in court of criminal law. So, and we need to constantly bring ourselves back to reality to counter his tendency to turn his unfitness into fitness and his criminality into victimhood. Now, criminal justice is not only for punishment, it is also for isolation and public safety, as well as deterrence. And it works far more effectively when combined with therapeutic approaches such as rehabilitation, or maybe even habilitation for the first time for certain individuals. So when just and transparent, criminal justice can work as an effective tool for tertiary prevention in public health. It is our current civilization's way of organizing violence with the intention to reduce the kinds of violence that threaten public safety by upholding social order, deterring crime, and sanctioning those who violate the laws in ways that meet their level of emotional development, because this is the kind of language that will speak to them. Legal systems authorize the police and the military to use violence within prescribed parameters. The level of force that is needed is not equal in all societies. Many modern societies in Western and Northern Europe have moved beyond using excessive force to focusing on community intervention, individual development, and restorative justice, where the criminal justice system is functionally closer to secondary than tertiary prevention. Secondary, if you remember, is intervening with those at risk to help them avoid the risk far before anything happens. So this means that greater effectiveness and less cost, indeed, they're doing a better job than the United States in improving public safety. They have far less levels of violence, or certainly gun violence as well, than we do. So it shows that tertiary prevention, while necessary, we should not stop there. So containment happens not just through incarceration, but also through hospitalization. I once treated a family in the outskirts of Boston that believed outer space aliens were invading their neighborhood. The father was a construction worker, the mother a former clerk, and the 5 children ranged in age from 8 to 16. They seemed respectable in public, but in private they were convinced that an alien force had taken over their neighbors, heralding the end of the world. They thought they were the only sane ones left and needed to save themselves before the alien invaders besieged them too. Now, how did this happen in this respectable, otherwise quite functional family? The mother, a domineering personality, was actually a patient of schizophrenia. She castigated members of the family who would not go along with her delusional beliefs. She castigated the only non-believing member, who was her 16-year-old daughter, who remained an outcast of the family. Now, the 16-year-old finally called 911 when her parents started barricading doors and sleeping with knives under their pillows. Fear and terror might have escalated into an aggressive attack, as they falsely believed themselves under assault. And this kind of paranoia is one of the most dangerous symptoms, even though those with mental illness are not necessarily more dangerous than those without. In fact, they're more likely to be victims of violence than perpetrators. But the one symptom that can increase violence is paranoia. And so a well-alerted ambulance personnel arrived safely, and the mother was transported to the nearest emergency room and then hospitalized. The way they were able to identify the primary person with the actual illness who spread her symptoms to others over time was through careful history. This is an instance of family psychosis, or folie à famille. It's a phenomenon that was first identified by the French, and so many would be familiar with the phrase folie à deux, which means madness between two, or it could be folie à trois, folie à quatre, folie à cinq, up to folie à million when it comes to a country, madness among millions. So what happened to this family? Within a matter of days, both the patient and the entire family, whom we call secondary persons with the illness. So the secondary persons are actually not even those who are ill. It just shows how dramatically mental symptoms can spread in the case of lack of mitigation by mental health intervention. Now, the 16-year-old, thanks to her early call for help, escaped transmission. But over time, if this condition continued of no intervention, even the 16-year-old would have succumbed. And she would have been the hardest to convert back, because there are many categories among those who are affected by the primary person symptoms. So the first among them is those who have the same illness. So in this family, there weren't any, but in a vast population, there would be those with the same illness as the primary individual. There would be others who have predisposing personality disorders, for example, that would make them vulnerable to developing the symptoms. And thirdly, there would be normal individuals who get swept up in the contagion, just like COVID-19 does not, no one is immune from it entirely. So eventually it affects normal individuals. So does mental health pandemic. And then lastly, it's those who resist and then succumb who are the hardest to convert back. But as with this family, removal of exposure was the treatment solution. And within days, the family, just as dramatically as they developed bizarre delusional symptoms, just like the primary psychotic individual, they all returned to normal. So I more than frequently have said that separating the leader, the so-called leader of the spread of symptoms, in whether it's in a street gang, a cell block, or as in the example that I gave, state hospital setting, that once you remove that primary individual, the secondary individuals dramatically return to normal and to their previous states of function. In the case of Donald Trump, his former attorney fixer, Michael Cohen, also experienced this change when a therapeutic separation happened with his own incarceration, as well as many others who had joined the January 6th violent insurrection against the US Capitol. But there does not have to be a shared psychosis to warrant hospitalization. The criterion for hospitalization is danger to self, others, or the public by reason of mental symptoms. Whereas law enforcement generally intervenes only after harm has happened, mental health professionals can intervene before it occurs, if there's reasonable expectation that harm will result if the current course were to continue. Involuntary hospitalization is a regular part of psychiatric treatment because of the nature of mental disorders, beginning with denial of illness as a symptom. In fact, the severity of symptoms can be measured by the severity of the denial. Those who need hospitalization and treatment the most are the least likely to seek it, and indeed usually run from it. Additionally, dangers can increase with compulsion or a powerful emotional drive that leads one to make destructive decisions that one would not otherwise make without the disease. So there's a judicial process that offers oversight, which diminishes the possibility of abuse, but this level of retention and detention of patients is given to psychiatrists and other mental health experts. So Donald Trump met criteria for involuntary hospitalization since the beginning, in my opinion, as I told The Atlantic in an interview in 2018. I was ridiculed at that time for saying so, but I was not incorrect. I would have been able to medically argue my opinion, and even so, I would be able to evidentially prove my opinion at the time. The finding alone of 2,026% spike in hate crimes in counties that hosted his rallies would have been enough criteria for hospitalization. It was also revealed that he was at the brink of going to nuclear war with North Korea, which White House Chief of Staff General John Kelly stopped after consulting our book and learning how to apply some of our mental health techniques. This is without going into his causing more American deaths than all the wars combined since the Civil War because of his COVID-19 pandemic mismanagement, not to mention worldwide deaths, as well as the deadly insurrection he incited that caused 174 police officers to be injured and 5 to die. and the massive human rights violations and deaths of journalists he likely encouraged through his bolstering of brutal dictatorial regimes. British psychiatrists once apparently geared up to section George W. Bush for calling for the Iraq War while he was president and visiting the UK, and so they were ready to involuntarily hospitalize him. Trump is multifold worse. Because the dangerousness is a situational, not a diagnostic assessment, his decision to run for the presidency made him more dangerous than before the decision, even if his diagnoses remain the same. But we don't need a diagnosis for assessing dangerousness. And we can conjecture that if he were hospitalized and psychiatrically evaluated, he would probably meet a dozen different diagnoses. But all we need to know for the involuntary sectioning is whether or not he's dangerous to himself, to others, or the public. And that we already know. In fact, we submitted a pre-sentencing report to Justice Merton when the first sentencing date was set to be mid-July. We submitted it in mid-June. A panel of the most eminent psychiatrists in our nation, if not the world, decided to gather to do a dangerousness risk assessment on the former president. Along with it, we also did a psychopathy scale, which is a good measure of dangerousness. And either of these assessments do not require a personal interview. Of course, we do our best to try to obtain an interview, but we had enough information to be able to go ahead with the assessment. And the more important data come not from a personal interview, where dangerous individuals especially lie, manipulate, and deceive in ways that actually take away from the accuracy of the assessment. So we followed standard procedure, as we often do for the courts. Psychiatrists and psychologists are often employed by the courts to recommend sentencing based on mental health status, dangerousness, and all these other factors. So that is what we have done. And well, now we're at a place where the sentencing will not happen until after the election. So that makes the possibility of involuntary hospitalization or containment of dangers to the public all the more important and may come to be at the forefront of our awareness and need to educate the public so as to prevent further harm to the public. So certainly Donald Trump has met criteria for involuntary hospitalization, not only from what he has shown through his presidency, but continues to show through his own words, such as by threatening a bloodbath if he lost the 2024 election, or stating that we need to root out the vermin in our country. What's important is not just the words, but the psychology that these words reveal and the pattern of denigration of groups of people, verbal aggressiveness, dehumanization, incitement of violence against certain groups, as well as his own violent acts and policies in the past. If we were a nation of laws, then we would recommend that no one is above mental health law, and certainly not natural law. And one of his treaters, or currently his probation officer, could step up to give him the proper medical standard of care that he indeed deserves. All 50 US states have provisions for an emergency psychiatric hold, which permits involuntary admission to a secure facility until a psychiatric examination can be performed, which any licensed physician or mental health professional who has seen him can initiate. Of course, this usually means a personal examination, but as I stated, danger is not just determined by a personal examination. And personal examination also does not necessarily mean personal interview. So I should actually correct that. We should do a personal examination, but a personal interview may be waived in this situation because of his the particular diagnoses that we would be concerned about, as well as the extensive collateral information that we already have.